They say to become an expert in your field, you need to spend time, ideally more than 10,000 hours. And not only that, but you need to get timely feedback on the subject. So when it comes to the USMLE or USMLE-like exams, there's nothing better than doing questions and getting feedback. In this episode, I will give you a USMLE style question, and it's regarding an asthma mimic. You guessed it right. It's called vocal cord dysfunction. This is an asthma mimic. Why? Because look at this case. You have a 30-year-old female patient diagnosed by the primary care physician as having asthma because she said she was getting episodes of shortness of breath and wheezing. And so the primary care physician said, there you go, you have asthma, take these medications, take these inhalers. She's using the medications as prescribed, and she had the chest x-ray that was normal. It is noticed that her shortness of breath and wheezing, sometimes with exercise, sometimes with stress, sometimes by fumes or irritants. So why is the patient not getting better despite the right treatment for the presumed asthma by the primary care physician? They ask you these questions. What is the next step for this patient? What do you think is the next step that will help the patient? Are you going to do a post-exercise spirometry? Are you going to give them a course of prednisone? Are you going to give them antibiotics? See, they want you to avoid the wrong answer. And they want you to know from this context that you are talking about an asthma mimic, an asthma that you presume but is not getting better with therapy. So it's time now to think, is this an asthma mimic? Is this vocal cord dysfunction? And if that's the case, you want to pick this answer, the post-exercise spirometry. First of all, let me explain to you why a patient with vocal cord dysfunction will have asthma-like symptoms. Because when you take a deep breath, or let's say you take any breath, the air will pass through the nose and the mouth and into the air pipe, into the trachea. But first, it has to go through the vocal folds. So naturally, when you inhale, the vocal cords will open to let air in. And in the patient with vocal cord dysfunction, when they inhale, the vocal cords actually close down. They come together. And that will create the sensation of shortness of breath and the sound of wheezing. Actually, when it happens when you inhale, wheezing in the upper respiratory is called stridor. So the patient will come with shortness of breath and stridor in episodes that are mimicking asthma, but they are not asthma, because when they are under stress, psychological or cold or fumes or exercise, and they try to take a deep breath, the vocal folds close. So what is the benefit of doing this post-exercise spirometry? Be familiar with this because they will give you this flow loop on the exam, and they want you just to diagnose your patient based on that. So usually when you inhale, this is the inhalation, this is the inspiratory, and this is the expiratory part. So what happens with the inspiratory is you take a deep breath, like you take a deep breath and it goes like that all the way. And then you exhale, and you exhale, the first part of it is fast and then kind of slows down. And that's the normal inspiratory, that's the normal flow loop. What happens with our patient when I have them do the trigger, like for this patient, let's say the trigger, she's an athlete, the trigger is exercise, she becomes short of breath. So she exercised and now I bring her to do the spirometry. Look what happens. When she inhales, the flow is not going up, it's flat curve. But when she exhales, it's normal. So flattening of this inspiratory part is diagnostic of vocal cord dysfunction. And it also helps if you have an otolaryngologist to look with laryngoscopy into her vocal cords during the event, and you can see them closing down. The treatment for this is, of course, avoidance of triggers. So you want to look if they have reflux like GERD or postnasal drip, but mostly it's reassurance that you don't have asthma, you don't have anything life-threatening, but speech therapy is helpful, and you should discontinue the asthma medications. And this is vocal cord dysfunction, an important asthma mimic. This question can earn you more points on the exam. If you like this content, please hit the like button and follow me and share it with your friends. Thank you.